Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
luteinizing hormone and follicle stimulating hormone. Natural luteinizing hormone and follicle stimulating hormone. Luteinizing hormone and follicle stimulating hormone are together known as gonadotropins. They are protein hormones. They have membrane bound receptors and they are released in pulsatile manner from the anterior pituitary. Follicle stimulating hormone is released when the pulse frequency of gonadotropin releasing hormone is low, and luteinizing hormone is released when the pulse frequency of gonadotropin releasing hormone is high. According to luteinizing hormone, the half life of luteinizing hormone is 20 minutes. Half life of follicle stimulating hormone is 3 to 4 hours. Follicle stimulating hormone is released when the gonadotropin releasing hormone pulse frequency is less, whereas luteinizing hormone is released when gonadotropin releasing hormone pulse frequency is more. That means gonadotropin releasing hormone is released in pulsatile manner, that is in higher amounts followed by lower amounts, then higher amounts, then lower amounts. If the pulse frequency is high, that is when luteinizing hormone is released. This is frequency. That means if the pulse frequency is like this, if there are more fluctuations, then luteinizing hormone is released. If pulse frequency is low, that is like this, then follicle stimulating hormone is released.
thank you and thank you for watching.